Good afternoon, friends, and my apologies. I had forgotten to unmute, but now I'm hoping you can hear me loud and clear. This is our 15th webinar, and we are talking as usual about COVID. Now, COVID is highly infectious. Millions of individuals around the world have fallen victim. However, it has a low mortality rate of less than 7%, and this is fortunate. However, those who survive are scarred with bizarre symptoms. And this continues for long periods up to 6 to 9 months after testing COVID negative. This situation is now commonly known as long COVID. In RAC Hospital, we have had our own share of survivors and warriors. Our warriors are our medical professionals who are the front line of defense in preventing and curing COVID. Our survivors are those who benefit from the treatment given by our medical professionals. Now, today, we have a group of individuals in two broad categories. We have our survivors, those of us from RAC Hospital who may have fallen victim to COVID. We have 4 such individuals. And then we have the 2 warriors who surprisingly have treated some of the survivors in today's program. So we start with our survivors, and each survivor will speak for about 5 minutes, and they will talk about the circumstances under which they got COVID, the treatment that they might have received either at home or in the hospital. How did they manage quarantine? What was the effect of quarantine on their work and on their families? What is their current status? What lessons have they learned? What advice can they give us? In the early days of COVID last year, one of our colleagues, Dr. Nithya, who is our manager quality control, fell victim to COVID. These were early days. She was hospitalized for well over a month and spent time in the ICU and had a lot of difficulty. Dr. Nithya has been gracious enough to agree to share some of her thoughts with us. Dr. Nithya.
Good morning to all. Thank you, Dr. Wilco, Professor Kennedy, and the team here to giving me this opportunity. And the well-said word, survivors. Survivors are war survivors and other survivors. And obviously, you know it's a pandemic. Now I'm termed as a pandemic survivor. And as Dr. Wilco and Professor said that I contacted this infection at the early days of COVID. And to be very precise, in the month of May, I got this infection and I was tested positive, and my symptoms were only fever and cough. I thought it would, like other colleagues of mine, I thought it would also be just, okay, 2 weeks of quarantine and then I would get better. So the once I tested positive, I was shifted to the quarantine center of RAC Hospital, and RAC Hospital has been very grateful for providing quarantine facility to all their family members and their employees. with state-of-the-art facility and medical care. So when I was shifted to the quarantine center, I just had fever, and within hours of 8 to 10 hours, I deteriorated and my cough got very severe, and immediately I was transferred to the hospital. In the hospital, from third to fourth day, I had very severe breathing difficulties, and I was put on oxygen support. And these days were very difficult, and I was treated by a very good medical team, Dr. Humam, Dr. Murthy, and everyone. And uh, the days in the ward were fine, and then very soon I deteriorated, and my breathing got very difficult, and I had to get into the ICU for further management. So when I got into the ICU, it was very difficult for me to get breathe, and my oxygen saturations were deteriorating and were coming down. And thanks to RAC Hospital, especially Dr. Raza and Dr. Gawar and the entire team, the ICU members, doctors, Dr. Wilco, everyone, there was nothing left on this earth which treatment which they wouldn't have tried or explored, so that I could get better at any given point of time. They tried everything under the sun to get me right. So it was a very difficult situation, since it was very difficult for me to and during this time there were lot many lessons learned, and lot many experiences. As a COVID, even cancer patients have opportunity to get that human touch and feel, which plays a very important part in healing. But in COVID-19, that's the major thing. Like, you are isolated, and what you see is only an empty room and some white image, white people with white gowns, fully covered, moving around you, and it becomes very difficult for you to recognize who is there behind those white PPE. And I salute to all those people who treated me, and without fear, they entered my room and gave me care without any hesitation, putting all their lives into trouble and taking that risk and treating all the COVID patients. And that's a uh, great thing which the healthcare workers do. And what I would want to say here is that COVID is a disease which is unpredictable. It has got a lot of post effect, as in many people have a lot of effects which come after COVID, and it is for some it is a permanent, and for some it is treatable. So here, what I would like to say here is that post-COVID, you have, especially with me, I still have difficulties in breathing, and I have difficulties in still having my original taste and smell back, and also. As I had complaints of tachycardia, which persisted over 6 months, and now on and off medications, and a lot of follow-up happens after COVID. So the message is that, like, COVID is a disease, for very important is that apart from all the medical care which the treatment, all the doctors and everyone who treated you and who treats you is very important, and also your self-confidence and the way you fight the disease is very, very important. So just a small experience, like when I was shifted to one of the hospitals from RAC to the ICU in Saif Hospital, there was one doctor that those 10th and 11th day of my disease was very critical. I didn't even know whether I would really see the world back, or I would see any of the family members of mine. And this doctor was there, and he said, like, you just have to say that you will survive whenever you are awake. And he made me do that. Like, I was like totally deteriorated and I could hardly speak, but he just said, keep saying this, I will survive, I will survive. Many times, whenever you are conscious, you keep saying that. And I really did that. And in the next 24 hours, I would say it's a miracle that I really got better. And it's only the self-confidence which adds up to the entire care, how you survive and how you come back, how you fight back the disease. So your mental health and mental strength is very important. Your confidence is very important. Do not lose hope. Uh, do not get disappointed, because everything happens, and your self-confidence can change everything, whatever happens to you. And uh, thank you is a very small word which is there in the vocabulary of English to express my gratitude to all those who have been throughout this journey of mine. And a special thanks to Dr. Raza, Dr. Gawar, Dr. Humam, Dr. Murthy, the executive team of RAC Hospital, and every single member of RAC Hospital, Dr. Vilku, Dr. Rajiv, Dr. Kiran, and all the ICU doctors and all the nursing team of ICU and the ward who took care of me during my disease, and every single person, my HR manager, Ms. Diana, who was a great support during the entire time, who kept in touch with my family, and the medical director. And giving support to the family is very important, because that's the worst part, that you cannot see your family member during your entire stay, and that's a very emotional stress. So recovery of COVID health-wise is very important, and the most important thing is your mental health also should be taken care of, because you undergo this quarantine of more. I was on quarantine for 42 days, and 42 days of isolation from the world was very, very difficult for a person of my work pattern and lifestyle, not seeing any humans, not interacting with anyone, and it's very difficult to get back to normal and face the normal life. And the only thing when I was sick was like, as my dad always used to say, that like appreciate every single thing in your life, and that's what COVID taught me. The only thing I wanted when I was in that room of RAC hospital was to just feel the sunlight on my skin, and just breathe fresh air without that oxygen mask on my face. So that's what you need. You need to appreciate everything in your life, and that's what COVID taught me. Every single thing, every single person around you, every single soul around you has to be appreciated, and that is very important. And that's a lesson I learned. And for people who have survivors in their families, and people who have faced COVID, please ensure that you take care of your health. Post COVID, you could have some kind of complications. Please revisit your doctors regularly. And also, there could be isolation makes a human behavioral change. That's what it is said. Like, and if one of your family members have a behavioral change post COVID, please try to adjust and appreciate that they survived COVID and came back. And you need to support them. That's very important. And I would like to take this forum to thank every single soul and everyone who sent their prayers across this globe for me. And especially a special thanks to every member of the RAC family, and not last, my mom and my brother, who was a great support to me. And thanks, Dr. Vilku and Professor, for giving me this forum. I think I took more than 5 minutes. Thank you.
Dr. Nithya, what can I say? You will have to forgive me the occasional tear. Thank you so much. Thank you so much. I mean, the amazing things you said. Appreciate life. All you wanted to see was the sun. And these are things we take for granted. That great doctor who said, repeat to yourself, I will survive. There could be no better treatment than that. Thank you so much, Dr. Nithya. I wish you could have carried on longer, but these 10 minutes have been very emotional. Thank you so much. Thank you so much.
Thank you, Doc.
And now, ladies and gentlemen, you will forgive me that occasional tear. I know that if the camera was on each one of you, it would have been exactly the same for you. So I am not embarrassed. We now have our second speaker, Mr. Jitin Jose. Now, Jitin Jose is one of our nurses in the Saker Clinic. And Jitin will tell us his experience with COVID. Jitin, the floor is yours, sir.
Good morning, all. Thank you, Dr. Wilco, Professor Kennedy, for having me this opportunity. My name is Jitin Jose. I am a registered nurse under RAC Hospital for the last 5 years. I am deputed in Saker Clinic as a nurse. I am from Kerala, India. In our clinic, we are managed the health of the employees. And am I audible?
You are audible, Jitin. Could you come on to the full screen if you don't mind? All we can see is yes, that would be much better. A little more. Yes. Oh, that's good. That's good. There's a lot of space above your head, Jitin. So if you can turn the camera down, we'll be able to see all of you. A little more. And that is perfect. Thank you, Jitin.
Okay, sir, thank you. Okay, so we at clinic, we are manage and help of the employees and shift crews, doctor consultation and regular monitoring, health empowerment, etc. During this pandemic, we are conducting COVID assessment and PCR swab collection, also taking care of post-COVID quarantine patients also. As you know, during the pandemic and the regular exposure to risk of getting infected, we are taking care of patients. During this time, I got infected COVID on 19 June 2020, which tend to be severe. So I was admitted in a RAC hospital. When I reached RAC hospital emergency, they took our X-ray. In that X-ray, there is some patches. So they decided to admit in room. So I was in the VIP room for 5 days. That time, after 2-3 days, my symptoms got worsened. I started breathing difficulties and continue running fever, high-grade fever, and my ferritin level also increased. So that I was admitted under Dr. Murthy. So this Dr. Murthy will decide to shift me in ICU for further management. So I was with oxygen support and conventional treatment in ICU. After 5 to 10 days, I will fully recover and I got 2 PCR negative. Then I was sent for quarantine for 10 days in staff accommodation. There also the RAC hospital team, doctors, nurses regularly visiting and taking care of me. And they give me fully support and all. During my admission hospital severity, I got anxious of my health and faith. As I knew there is no proper cure for pandemic virus. Got very depressed as I am living far from my family. In my room also, I feel alone. Sometimes I feel to jump from the floor because I am feeling that much aloneness. Though the doctors, the nurses, they are supporting very much for me to recover this. Now I am fully recovered. I am promoting and supporting this employees in our clinic. I am really thankful to our RAC hospital doctors, our sisters, especially our nursing director, Ma'am Sue, our HR, Mrs. Diana, and Dr. Murthy, Dr. Humam, and Dr. Vilku. As we know, prevention is better than cure. So be safe and be healthy. Thank you for giving me this opportunity. Thank you all.
And thank you. Thank you, Jitin. Thank you so much. Friends, every day when I come into the office, just in front of my office, there is a large tent in which several of our nurses are sitting in every day, day after day, almost during the last 1 year. And hundreds of our colleagues from different parts of our city come in for testing and discussion, and then move on to meet with our doctors. I am so grateful to Jitin. He was a nurse managing, amongst other things, COVID. He got COVID. He underwent the entire session of treatment, even in the ICU. He felt isolated. He felt anxious. He felt alone. He felt suicidal. And yet, Jitin is back helping others. That is why we have the greatest of respect for these great frontline warriors. Jitin is a survivor. He is also a warrior. Thank you very much, Jitin. Thank you so much.
Thank you, sir. Thank you.
Our third speaker is not a member of the RAC hospital, but he is a member of the larger community in Ras Al Khaimah. I refer to our dear friend, Mr. Tapan Bhatt from GEMS School, GEMS International. And I have the greatest of affection for this institution because my granddaughter studies there. And Tapan will not know this, but I have had the great pleasure of going to GEM School, standing in the sun, waiting for my little granddaughter to come out. So, sir, gratitude comes in different ways, and I am grateful to GEM School. Thank you so much for that. However, Tapan, unfortunately, also got COVID. And now I'd like to listen, as I'm sure all of us in the webinar would, like to listen to Tapan's experience with COVID. Tapan.
Hello and good morning to everyone. Before I narrate my experience, I would like to thank Professor Kennedy, Dr. Wilku, and the entire team of RAC Hospital for this wonderful initiative of organizing a series of webinars. I've been a regular attendee of these webinars, and I have learned so many things. Our school and RAC Hospital share a long relationship with regards to providing emergency services to our school community. As a manager of school operations, other than operational matters, one of my key responsibilities is to manage the school and the school community safely. My positive report was a shock to everyone, except for me and my wife. Only we knew what had happened in the month of December 2020. I would rather call it a stupid or a suicidal attempt. Despite all our resistance and objections, under the social pressure, we had to go to Dubai to entertain someone. Whole day we spent with them, knowing that they were showing all the symptoms of COVID. Now, being a key responsible person in the school, I was taking so much of precautions to safeguard my school community, and I was so careless in meeting these people.
Tapan,
Yes, sir.
We are only seeing half of you. So do you mind adjusting your camera a little more?
Is this okay?
It's better, but we are just seeing the top of your head. If you can lower the camera. Yeah, that's perfect. That's perfect, Tapan. Thank you so
All
much. Thank you so much.
Thank you,
Thank
sir.
you.
Thank you. So it was a suicidal attempt when we spent the whole day with somebody who was showing all kind of symptoms. And on the 4th of January, around 8 p.m., I called Dr. Wilku complaining about the chilling and the tiredness that I was feeling. Dr. Wilku immediately arranged for my PCR. I went to RAC hospital, got my PCR done, and early morning, as expected, I was detected positive. Dr. Wilku immediately arranged some medicines. I and my wife both are diabetic, so my first priority immediately became to keep my wife safe. I had isolated myself and was taking maximum precautions. She was sent for PCR 2 times in 5 days, and her reports came negative. On the 6th day, she also started complaining about the same symptoms and showing the same symptoms. I remember on the 9th day of my illness, while I was taking bath, suddenly for the first time I felt shortness of breath. I was losing my breath, and it took almost 15 minutes for me to settle down. On the 11th day, soon after 2 hours of my first negative report, my wife was detected positive. So we were paying a very high cost for the mistake that we had. And walking a few meters resulted in shortness of breath. While we were in TAC hospital for my wife's PCR, I had to walk down to the sample collection area, where once again I experienced the same shortness of breath. And with the support of Dr. Wilku, I approached Dr. Slavika, who with so much of care started my treatment. After the first round of CT scan and X-ray, I was advised to contact a pulmonologist for further advice. On the 6th day from meeting Dr. Slavika, finally I got an appointment in Dubai to visit a pulmonologist. My first spirometry report came as 29%. I was surprised that how come my oximeter was showing 96, 97%, keeping me at home, not rushing to the hospital, and still my lung capacity is showing only 29%. He prescribed some medicines along with an inhaler pump and nebulizer. Next week, the second spirometry report came to 51%. I was on the path of recovery. And following week, 69%. Again, we were worried that why the progress is not showing as expected. And one more CT scan, change in medicines. Dr. Wilku also suggested some breathing exercise. I asked doctors that I play saxophone. Can I start playing my saxophone? Because it requires a lot of air to be kept in lungs and then, blow hard. Doctor suggested that instead of blowing in the respirometer, it's better you start playing your saxophone. And we were also privileged to attend COVID rehabilitation program. I and my wife went there for the whole day. And final spirometry report came to 97%. There was a feeling of victory over the deadly virus. I won't call myself a survivor. I would call it to know a victorious. I returned to my routine. Throughout this entire illness, I was working from home. I had not taken a single leave. Maybe that was one of the forces that kept me alive and kind of developed the spirit to fight this virus. My support system was very strong. From Dr. Wilku to my own team, my family, school principal, and all the staff supported me during this difficult time. The entire supply chain of food to medicine, minute requirement was managed by my team, which was a tremendous boost to our recovery. I see a lot of people without mask, so careless. They feel that their virus is no more. And I feel pity for their thinking. They still don't understand that virus is still around us. It is invisible. It can attack anyone at any time. and we still do not know what surprises it is going to bring in the future. I always request the people that I meet who live in this kind of a fantasy world. They don't wear masks, they don't maintain the distance. They are so careless. I always tell them that you have this life, respect your life, respect the people around you. There are so many people back home are always thinking about you. So why do you want to put them into unnecessary tension, and why you want to put your life at risk? And I personally have learned a big lesson in my life, that being such an important person in the school, so many people are depending on my decision on the health and safety. How could I put myself in such a stupid situation? I have taken extraordinary care, but that particular move was a suicidal move. Anyway, I have recovered fully well. After my recovery, I have recorded many songs on my saxophone dedicated to my wife for whatever she has done for me and whatever she has been doing for all these years. I will conclude here by thanking my wife for her love, care, and support, Dr. Wilku, Dr. Slavika, and the entire team of RAC Hospital for their extraordinary care and support. Thank you very much for this opportunity. God bless everyone.
Tapan, that was so good. That was so good, Tapan. Had I known earlier that you played the saxophone, I would have insisted that you play a little rhyme for us. That was excellent, Tapan. Thank you so much. But the lessons that you have learned and the lessons that you have taught us are indeed remarkable. First of all, my gratitude to Dr. Wilku. I have, during this webinar, heard Dr. Wilku's name mentioned often enough. He epitomizes exactly what all medical professionals are: helpful to the point of overextending himself. Well done, Dr. Wilku, well done. Now, I agree with you, Tapan, when you say that going to Dubai for that social function was the mistake that you made. And you have berated yourself by calling yourself stupid. I would not go to that extent. We all have our little failings. Unfortunately, your wife also got COVID. But at the same time, you were so grateful to her and to your entire support system for all the help that you got, that you and your family got throughout the period of COVID. Remarkably, your lung function from 29% went back to 97%. I am sure that the advice of your medical professionals and the medicines that they gave you played a major role, but I have no doubt in my mind that your saxophone definitely had a role to play in that. You ended by saying that the virus was, that those of us who do not wear masks live in a fantasy world, that the virus is invisible and it can attack any one of us at any given time. And I absolutely agree with you on that. Thank you so much. Thank you so much, Tapan.
Thank you, sir.
And now, ladies and gentlemen, we have Dr. Rahul Ali. Now, Dr. Rahul Ali is the Director Global Programming OneSight in the United States of America. Now, Dr. Rahul, as I recall, and I must mention to you that Dr. Rahul is also my son-in-law, and it is his beautiful daughter and my gorgeous granddaughter that I go to pick up from Tapan School in GEMS. Now, as I remember well, Dr. Rahul decided that he would move out of the United States temporarily because COVID was all around, and his office had decided that they could all work from home. And so in order to work from home, Rahul was kind enough to come with his beautiful family to Russell Khaimah, which is where I live. But none of us realized that, as Tapan rightly said, COVID is everywhere. And Dr. Rahul Ali, student and teacher of preventive health from the outstanding Institute of Johns Hopkins, fell victim to COVID. That is wrong of me to laugh. I should really never have laughed at that. And my apologies to Rahul for that. Well, I'll leave the rest for Rahul to tell us. Ladies and gentlemen, I present to you Dr. Rahul Ali.
Hi, good morning, everyone. And thank you so much, Professor Kennedy and Dr. Wilku, for this opportunity. I just like to, before I start off, like to really congratulate the team at Arabian Wellness and Lifestyle Management for this amazing series of webinars. It's a serious service to the community at large within RAC and beyond. So congratulations to AWLM and everybody at RAC Hospital. And I assure you, my introduction was much more dramatic than my actual COVID story will be. But let me just give you a brief overview of our experience. And I say our because it was actually a full family experience. So way back on around the 28th of June, my wife started having a sore throat. And it progressed to a little bit of a cold, mild fever. And by the 2nd of July, 4 days after that, I started having a bit of a sore throat. So a day or two after that, we actually went to a hospital. And the doctor surprisingly did not advise a PCR test. We got some medicines for my wife and came home. I was not totally convinced. Being a public health person, I actually specifically asked for the test. What I would like to reiterate here, and being a doctor, I think I can get away by saying this: doctors are not gods. Please, please, please maintain a high degree of suspicion. The pandemic has not ended. It has gone down, cases have gone down, mortality rates have gone down, but it is still there. Even if you're vaccinated, you can get it. If you have predisposing factors like diabetes, obesity, other immunocompromised statuses, please take care. So anyways, with that, my health started to dip a little bit. I started getting a fever, my cold got worse. So anyways, a day or two later, we went and got tested. And lo and behold, my wife's result came back at 6 p.m., which was negative. So we were all very relieved because it all started with her. I thought, okay, fine, if she's negative, I should be negative too. I sat with my mother, who's 78 years old and diabetic, as I am. I'm not 78, I'm just diabetic. We sat together and had tea in the evening, feeling very good about things. And at 2 in the morning, I got a call from Professor Kennedy, who incidentally, my RAC hospital ID was linked to his phone at that time. I got a call that, son, you're positive. So immediately I put some clothes into a small suitcase, went over to his place and locked myself up in his guest room. And in the morning, since my wife was negative, but it was obviously the same bug which had us, which is COVID, we both decided to quarantine at Dad's house and he shifted into our apartment. And sure enough, by evening, my elder daughter started complaining of some throat pain and she joined us. It was a bit of a family reunion, which was nice in that I didn't feel the sense of isolation of being alone in a room and only people in hazmat suits walking around me. And it was good, but I was still in a separate room and they were in a separate room. And on the 9th, 2 days after I started my quarantine, my younger daughter, who's like 3 years old, started complaining of a runny nose. So we got her shifted to my father-in-law's apartment also. So it was a little bit of a family reunion, even though I was not allowed out of my room, but at least I could hear laughter and running around and crying and fighting between the kids. And I could hear my wife scolding them and things. And because my wife was there, luckily I got home food rather than hospital food, which is always a relief. So symptom-wise, just want to reiterate that my COVID episode, by the grace of God, was actually very mild. I had a bit of a sore throat, cold, fever. I never really had much of a cough. I didn't have any breathing difficulty. By day 9, my fever stopped being in control with just paracetamol. So I had to add Voltaren also, and my oxygen saturation kind of started dipping around the 95, 94 levels. And being a doctor always is not the best thing, because you know of all that can go wrong. And it's scary that that's the time when the cytokine storm kicks in and you can go from 94 down to any level within a matter of hours. And you're in that happy hypoxia kind of state. So it was scary, but luckily within a day or two, my fever came under control and I was fine. And by day 14 to 15th of July, I was feeling a lot better, and I tested negative a day after that. So overall, not a very dramatic experience. I thank God, I thank my entire support system, family. I actually went to the Kuwaiti Health Center in Iraq to register myself as a COVID positive patient and whatever medicines they gave. So I was only on oral medication. But I must seriously thank the Iraq hospital team. I cannot tell you how reassuring it is to know that Iraq hospital exists and it's only 10 minutes away from Yasmin Village. You know, so that I knew that if anything happened, I had a place to go to, and that is a source of tremendous relief, especially when it's you and your family and you're like responsible for your wife and kids. So that was really good. Emotionally, it was nice to actually be locked up with your wife and kids and nobody else can come and go, and you have no work obligations, nothing, because you're in quarantine. So that was nice. But post-COVID, I think those of us who have gone through COVID and have any even vague symptoms of post-COVID, I think it's important to not beat yourself up over it and just accept the fact that it's a health condition. It's there, it should hopefully get better, and life has to go on. And I must say, I used to think of people talking about brain fog as just an excuse to hide behind something, but it is real. And I must say that soon after I recovered, we had our Africa meeting. I'd gone to Rwanda for that. And I was struggling to pay attention to the presenters. And as they presented, I would zone out for a few seconds and come back. And it was bothering me until I realized what was happening. And then you just accept it and say, okay, fine. If you're going to zone out, let yourself go, but bring yourself back. So you have to kind of build your own strategies to cope with whatever is happening, because at the end of the day, there's a whole life ahead of you and miles to go before we sleep. So with that, I'm going to stop talking and just thank you, everybody. Thanks for this opportunity, and good luck to everybody who hasn't had COVID. Hope you don't get it. To those of us who have had it and survived, thank you and congratulations, and keep going. And my condolences with all of us who have lost near and dear ones to this illness. Thanks.
Thank you, Rahul. I am so proud of you, son. Thank you so much. Now, there are a few things that Rahul said, some of which was music to my ears. I recall when Rahul left, Rahul and his family, my daughter Zarina and the babies, when they left the United States, I asked them, I said, why are you leaving one of the leading countries in the world to come to Ras Al Khaimah? I mean, surely you should stay where you are. And Rahul at that time said that it is so important to my well-being and the well-being of my family to have a hospital that is a home. And he did describe what he said, his gratitude for the fact that RAC Hospital exists. And as a part of RAC Hospital, I am so delighted with that explanation. He also mentioned his fear of knowledge, not his fear of knowledge, but his realization that he had abundant knowledge and therefore could jump to many, many different conclusions. Anyhow, The bright side of Rahul's experience is the fact that he and his lovely little family of wife and 2 children were isolated in my home all by themselves for the whole of 2 weeks. And now they are happily part of the larger community. Thank you so much for that, Rahul. Now, we've had our 4 survivors, and we are now going to look at and listen to and pay attention to our warriors. I referred to warriors when I spoke, when I thanked Jitin for doing the work that he did as a nurse. And I am doubly grateful to our 2 warriors who have kindly agreed to spend a few moments talking to us about how to manage COVID. We have, first of all, Dr. Humam. Now, Dr. Humam is one of the senior most members of the RAC Hospital medical team. And he has trained around the world. He had his medical training in the University of Baghdad, and then he went on to do his master's from Indonesia. He spent time working in Indonesia, and then he also worked in Bahrain, even while that is not mentioned in his protocol over here. He is a board-certified internal medical specialist from Jordan, Amman. He has an interest and did a fellowship in diabetes. And he is avidly interested, qualified, and certified in the management of chronic diseases. That would be cardiac ailments, hypertension, diabetes, and other such lifestyle ailments. Dr. Humam has also treated several of our survivors, and we would like to listen to what he has to say. Dr. Humam.
Thank you very much, Dr. Kennedy, and thank you, Dr. Wako, for giving me this opportunity to share my experience. We are in RAC Hospital, as every doctor around the world. We were watching and listening to the news of the new epidemic, the pandemic, and then the emerging disease, COVID, SARS-CoV-2, when it happened at that time. We don't have enough information about the disease at that time. And we were watching and listening to the news until the disease came to us, to our country, and we have a few cases in the beginning, and then the number increased over time. We were learning, actually, this is an emerging disease, emerging because it is a new disease. We don't have any previous experience. We have to learn from the others who faced the disease before, and we have also to handle the cases and treat the patients. I will share my slides with you. So my talk will be about the COVID-19 infection, fighting and learning from the emerging pandemic. We know that any infection, like this COVID-19 infection, patients can get the infection either asymptomatic or can be symptomatic with the disease. Those who are symptomatic can, the asymptomatic can recover or can have a chronic disease. Those who are symptomatic can also recover or can have sequelae after they recover from the disease, or some of the patients can have severe sequences and they can die. So if we classify the COVID infection, it is mild, moderate, severe, and critical. We are in hospital, so we are receiving cases who are admitted to hospital according to the guideline should be more than moderate, because people who have mild or moderate disease is still not very symptomatic, they can be managed at home. Those who are severe or critical condition, usually we admit them to hospital. And most of the cases we encounter here, either moderate to severe or critical. The simple information about the severe condition or moderate to severe, those who have a drop in oxygen saturation and they require oxygen supplementation, and those who are having a severe dyspnea and breathlessness, and those who are critical, at that time their organ start to be involved with the infection. So they start to have organ involvement and some unfortunate sequelae of organ failure. And so these conditions either end in the ICU and they recover, or unfortunately some of them died. The usual people who have the sequelae of getting severe infection or a critical condition are usually those who have high risk. Those who have high risk, usually the elderly people more than 60, people who are obese, having comorbidities like diabetes, hypertension, lung diseases, those people who have a chronic kidney disease or are immunocompromised because of HIV or immunocompromising medication. Unfortunately, COVID SARS-2 have a mortality rate ranging from 2 to 5%. It means that 1 in 50 people who got the disease might die. Severe critical condition, usually because of severe pneumonia involving more than 50% of the lung, and at that time there will be problem with oxygen transfer from the lung to the blood. This also, they have a severe inflammatory response with the release of inflammatory markers, and this at that time we will have multi-organ problems, because what we name it cytokine storm started. And signs and symptoms, we know that most of our survivors, they mention what they got from the symptoms like shortness of breath, sometimes sore throat, difficulty in swallowing, cough, loss of smell. And then by time, usually after 1 week, they start to have, if they progress to a severe disease, they start to have severe difficulty in breathing, severe tiredness, fatigue. The management in the beginning, as I told you, it is an emerging infection. We don't have enough resources to fight such infection, and we don't have enough information. We don't have at that time any guideline to follow. So we started to manage these people with supportive treatment, and also following some of the guidelines and our knowledge of how to treat people with infection, especially viral respiratory tract infection. So that is what we did. People who came with severe difficulty in breathing, the most important is with oxygen supplementation. To the severity of the desaturation and a drop in oxygen saturation. Usually we start with a simple oxygen, face mask, nasal cannula. Those who cannot maintain enough oxygen saturation, we shift to high flow nasal cannula. Sometimes people also cannot maintain, we shift to the CPAP, which we name it non-invasive ventilation. If it's still their oxygen saturation dropping, or they start to have carbon dioxide accumulation in the blood, we shift them to the ventilator. Some people, even in the ventilator, they stayed having a continuous drop in oxygen saturation, and now in other part of the world are using the ECMO, extracorporeal membrane oxygenation, which is unfortunately not available in our hospital. So the management is supportive. Those people who have severe viral infection with cytokine storm, they start to have superadded bacterial infection, drop in blood pressure, and then we have to support them with either fluid or blood pressure support medication in order to support their blood pressure, because those people will pass into what we name in septic shock and circulatory failure. Organ failure, critical ill patients started when they have severe involvement of the other body organs with either the cytokine storm or because of the severe drop in the blood pressure and sepsis. Most of these people, they start to have kidney involvement, and by time also they will develop electrolyte imbalance, and then they have some problems with the heart, either direct involvement from the infection or because of the electrolyte imbalance and the sepsis, they start to have either arrhythmias or cardiac arrest. So I will give you some of the cases we faced. I selected some of the cases just to tell you what we were facing during this period and what is the prognosis of the cases. So we will start with the first case. This is a 27-year-old gentleman who were presented with severe shortness of breath, a drop in oxygen saturation, and he was having about 45 to 50% lung involvement. He is, before the admission, he was normal. There was no chronic illnesses, and he is athletic, and he was having no chronic medication. So the patient was managed with oxygen supplementation. He didn't require admission to the ICU, although on day 9, his before that, his oxygen dropped dramatically, but he was able to maintain enough oxygen saturation. And at day 9, oxygen saturation improved suddenly, and his air entry to the lung also improved, and he was discharged on day 11 after his admission. On his follow-up, he returned after 1 month. He was absolutely fine. There was no any symptoms, and he was happy. So this is a case that the patient completely recovered from the infection without any symptoms after the infection. So this is a young, previously healthy, survived free from any symptoms. The second case, this is unfortunate 32 years old lady, a mother of 4 children. She is morbidly obese. She is 160 kg. She is short stature. Her body mass index about 62. She is morbidly obese. She has a history of childhood asthma. Unfortunately, she was late to be presented to hospital. Her husband also was positive, and he was quarantined at that time. So she was staying at home for a long period of time until her husband was released from his quarantine, and he came to see his wife very ill, and he brought her to our hospital. On presentation, she was severely dyspneic and tachypneic. The oxygen saturation at one time while she is in ER dropped down to 75. She was admitted to the ICU, and her imaging study shows severe bilateral lung involvement. And she was managed in the beginning with high flow nasal cannula and then non-invasive ventilation, and then she was attached to the ventilator. The patient stayed with us for 4 weeks. During this period, she has a lot of complications. She developed sepsis, septic shock. She was managed with IV fluid, blood pressure support medication. And during this period, we have follow-up evaluation for her lung. Her lung was completely fibrosed. She is morbidly obese, and if you see her CT scan, the body wall thickness is equal to the lung diameter. So if you can imagine that a hair, two circle surrounded by a lot of fat of the body. And this lung was fibrosed. So this picture was actually very bad to see. We expected that she will never survive. And if she survives, she will be oxygen bound all of her life. The patient deteriorated and she developed emphysema in the lung, and she has at one time a left pneumothorax, which was managed by chest tube insertion. She deteriorated, and unfortunately, she couldn't make it, and she died. So this is a case of young lady, morbidly obese, late presentation, unfortunately complicated, and died. Another case, this gentleman, 68 years old, this patient have comorbidities. He has diabetes, hypertension on medication. Fortunately, this patient was from the first people who received the Sinopharm vaccination, which was introduced at the beginning of the 2020. His oxygen saturation was low. He was admitted to the ward, and he was managed with, according to the protocol, with oxygen supplementation. He spent some time with us, but fortunately, he improved, and we were able to discharge him home with oxygen supplementation. So this is an old gentleman with comorbidities, but fortunately, he had vaccination. He survived. Post-COVID symptoms, he has tiredness, fatigue, breathlessness on exertion. This case is about 74-year-old gentleman who has positive PCR and presented with shortness of breath. Oxygen saturation was down to 89. He has diabetes, hypertension, and he was already diagnosed to have chronic obstructive lung disease. This patient was admitted in the beginning to the ICU, but he refused admission, and he refused any advanced oxygen supplementation with high flow nasal cannula and CPAP. So we admitted him to the ward, and we tried to help him with oxygen supplementation with the nasal can, with the face mask. He was maintaining acceptable oxygen saturation. He spent some time with us, and we were able also to discharge him well on oxygen saturation. And he came for follow-up after 3 months from his discharge. Was having shortness of breath. He was seen by pulmonologist outside, and he was started on one of the modern medicine for lung fibrosis. He was happy to survive. So this is a case with comorbidities. Old patient fortunately survived, but post-COVID, he continued to have tiredness, fatigue. He was having anxiety, and he had shortness of breath with simple exertion. Another case, the next two cases actually are transfer cases from their hospitals to our hospital. This is about one gentleman, 68-year-old gentleman with chronic lung disease. He has a sort of an autoimmune lung disease. He was already having a problem with the lung when he got the infection. He was severely tired in other hospital, and he was on ventilator for some time. And he was discharged on high nasal cannula supplementation, and he asked to be transferred to our hospital. His lung was not good, already having a chronic lung disease, autoimmune disease, and having now post-COVID lung fibrosis. The patient have claustrophobia, and by time when he was admitted to our hospital, he should be attached to at least a CPAP or BiPAP, because he has carbon dioxide in very high level. It was around 80%. So this patient refused any change of his current high flow nasal cannula, and we were forced to continue on high flow nasal cannula all the time, although there was persistent carbon dioxide retention. The patient unfortunately deteriorate, and at some time he have somnolence, CO2 retention, asterixis, and he was having deterioration of the level of the consciousness. At this level, we admitted him to the ICU, and we sedate him and attached him to the ventilator. But unfortunately, he didn't make it, and he died. So this is an old gentleman with lung disease, complicated, and unfortunately, we couldn't help him. Another case, this is young patient, 40 years old gentleman who had history of diabetes mellitus. He was admitted to other hospital, COVID government hospital. He was on mechanical ventilation for almost 2 months. He was negative, COVID negative, and he required only continuation of the management because of some problem with the insurance and payment. He was transferred to our hospital because his insurance is working in our hospital. So we accepted him. We managed him. He was having a lot of problems when he came. He was unconscious because of the under sedation, and he was having a lot of problems at that time. He was emaciated, severe loss of weight, muscle wasting. His culture from urine was fungal infection, and from the endotracheal tube, he was having very bad bug, multi-drug resistant Acinetobacter baumannii. We managed him. Actually, we were thinking that he might deteriorate at any time, but fortunately, with the help of our ICU staff, we could help him, and gradually we were able to wean him from ventilator, and we started active physiotherapy. He improved gradually. He regained his consciousness, but unfortunately, at one moment, he was having severe muscle weakness and unable to move any limbs, upper or lower limbs. We continued intensive physiotherapy, and actually he improved. He was fine. At the end, he was discharged on wheelchair with oxygen supplementation. He's filling our hospital regularly. He came maybe 10 days ago. He was fine. He was able to move. He regained his muscle power, but still have difficulty in breathing on exertion. So this is about a young gentleman, diabetic, 2 months on ventilator, lung fibrosis, but survived with breathing difficulty. Post-COVID symptoms, he have palpitation, occasional difficulty in memory, difficulty in concentration. He has anxiety and stress, muscle aches, tiredness, and fatigue. So this is what we name it, long COVID or long howlers. We know that most of the patients with COVID, they recovered, but some of the people have some of the symptoms persist over weeks or months. These symptoms can be either weakness, fatigue, some of the GIT symptoms, diarrhea, palpitation, breathlessness, loss of taste and loss of smell can persist for some time, and some people, they don't regain this senses. Some of the patients have brain fog, like difficulty in memory and concentration, and a lot of the patients stay to have some stress and also an anxiety. By this, I'm finishing my presentation. Thank you.
Thank you, Dr. Humam. Thank you very much. That was very enlightening. You spoke about respiratory failure, circulatory failure, multi-organ failure, and then you went on to give us so many examples of individuals that you had treated with such different symptoms, and it was very, very enlightening. We are so grateful to have you with us, sir. We are so grateful, and I'm sure your patients and the community may be even more grateful than I have mentioned. Congratulations on your success, and thank you so much for the support you provide. Thank you, Dr. Humam. Our next speaker is Dr. Murthy.
Yes.
Now, Dr. Murthy, Dr. Kaveri Sri R. Murthy, he received his medical degree from India and did his MD in internal medicine from Madras Medical College, also India, and then went on to do a postgraduate certification in diabetology from Johns Hopkins, the renowned medical institution and university in the United States. He has many years, several decades of clinical experience, and was the medical superintendent in the Atomic Energy Hospital in India. He has a vast range of interests: diabetes, chronic disease, heart disease, metabolic syndrome, obesity, and even infectious diseases. Friends, I present to you Dr. Murthy.
Good morning, everybody. At the outset, let me thank organizers for giving me the opportunity to talk in this forum and be a part of this great team. Today, I would like to share with you all my personal experiences during the pandemic, both as a warrior and as a survivor. It's not coming. What happened?
You're sounding perfectly good, Dr. Murthy. Yes, and we can see your PPTs also.
Yes, yes. Hey, this is not coming here.
They are able to see the screen.
Yeah, it's not moving. Before we delve into this talk about our shared journey over the past year and a half, it is important to acknowledge the shared struggle we have faced as a community in this time. COVID-19 is the most significant public health challenge the world has faced since the Middle Ages. Over 219 million cases worldwide and 4.5 million deaths and counting. United Arab Emirates' current figures are promising, with less than 200 new cases per day and death in single figures. Let us compare the COVID-19 with the common flu. You see that the incubation period of common flu is only 1 to 4 days, but COVID is 1 to 14 days. But hospitalization, you see it. Only hospitalization in flu cases only 2%, but in COVID-19 is 19%. See the fatality rate, only 0.1 in flu, common flu, but in COVID, it is 1 to 4%. See the deadliness of COVID. Deadliness of COVID-19 versus seasonal flu. You see the age figure. The seasonal flu is only mortality only 0.06 in ages 15 to 64 years. The same thing, 1.3% in COVID. See above 60. In common flu, it is only 0.8%. You see in COVID, above 60, it is 6%. It is telling us the deadliness of COVID. You see the common variant now, Delta variant. Previously, initially, we know the beginning variants, they only affecting the above 60 and people having comorbid conditions like hypertension, diabetic, kidney failure, and on immunosuppressants and lung problems, everything. But this new COVID variant Delta is affecting across all the ages. We are seeing a lot of mortality. It becomes very fast spreading and also very lethal. I see the comparison the season flu. But that is the flu, the common, this is the COVID is really very severe infection. That's why we are all worried about that. The COVID measures undertaken by the United Arab Emirates. Fortunately, the United Arab Emirates has ensured right from the state that the highest standards were followed in keeping with available evidence. This was manifest in the dramatic and unique large-scale sterilization drives of public areas, setting up numerous field hospitals, making available high-quality testing, and of course, the huge success with the vaccination drive. The nation adapted strategies to ensure the safety of its people, and this is reflected in the latest figures of less than 200 cases per day and very few mortalities. Experience as a doctor, branded frontline warriors, the healthcare staff were in a precarious position during the early stages of the pandemic. The main challenges faced by the sector were cases exceeded available infrastructure to care for the explosive numbers, non-existent treatment protocols. Scientists and doctors were racing against time to come up with immediate management protocols and long-term solutions. Unusual presentation of the virus, not keeping with anything we have encountered before. Measures undertaken, aggressive screening and isolation of the affected patients and contacts, making available space in the hospitals by discharging patients safely as early as possible, delaying planned procedures, increasing capacity and construction of new infrastructure to accommodate demand. Following the latest treatment guidelines in keeping with international guidelines and evidence-based medicine, providing state-of-art PPE to staff and patients, and following strict precautionary measures to minimize spread of infection. All healthcare staff heroically undertook the burden of added hours, stressful working conditions, and enormous personal sacrifices to help those affected. The humble truth, something even a lifetime of being a physician prepares one for. There were simply too many variables, too much unknown about the diseases. Time was some problem. I go next one. Yeah, some problem slides, sir. See, as a physician in the hospital, while treating the patients, what happened? We divide the patient into mild cases, moderate cases, and severe cases. In mild cases, we had given only symptomatic treatment. In moderate and severe cases, moderate with difficulty breathing problem, we have started antiviral treatment, we have started steroids, we are giving anticoagulant. In some cases, we had used remdesivir and interferons and interferons, and we have given all supportive measures to maintain the blood pressure and organ functions. So some problem, yeah. We see that completely from the beginning. We don't know what are the medicines are available, what are the treatment protocols. At the times goes on, we come to know the protocols now. In our Ministry of Health given a latest protocols how to treat the COVID patients. At the beginning, we don't have any medicines. Only one medicine. You see that worldwide crumbling healthcare sector trialed an area of medications based on limited evidence as the last resort to severe cases. Their joint efforts, including that of numerous trials conducted in the UAE itself, has now offered some strategies to help combat this illness. The main game changer being steroids, a drug that reduces inflammation in various organs and tissues in a body that is desperately trying to fight off the vicious viral pathogen. This comes with its own challenges, but at a stands remain one of the most important treatment modalities in moderate and severe cases. In moderate and severe cases also, Ministry of the Health given a protocol to use remdesivir, interferons, and anticoagulants. Death, depression, helplessness. The effects of pandemic on healthcare staff have been compared by several studies to be reminiscent of fields post-World War II. Many doctors faced more number of patient deaths in the past year than they have in their entire career before put together. With limited treatment modalities, limited resources, no vaccine in sight, many of us prayed for a miracle. The personal toll was furthered by the general air of despair and helplessness. Support bubble shrunk, and interaction with family and friends were minimal to none to prevent cross-infection. My experience as a patient, my wife and I both tested positive for COVID in early December 2020. It was sobering experience to be on the other side of a doctor-patient relationship. Friends and family in the country were not allowed to visit us in the hospital. Even I was moved to ICU. Family abroad could not even fly down due to travel restrictions in place at that time. Despite receiving the best possible care, knowing the limitations of our knowledge and efforts was not a soothing thought. My wife and I made a full recovery, me after close to a week in the ICU. Where we stand now, despite the harrowing time we all faced, we have come out of it stronger as a people, as a community, and humanity as a whole. Everyone did their part to bring this under control and made it possible for us to be where we are today. It was no one person or one country, but humanity as a whole. It is our combined efforts that has seen us through the eye of the storm. What now? The pandemic is ongoing and cases will continue to fluctuate seasonally and with the occurrence of new mutations, but we know more now than we did 18 months ago. Continue to exercise caution with regards to personal and hand hygiene. Wear a mask in public, whether or not this is lawfully mandates. Get yourself and your loved ones vaccinated and keep track of when you need your boosters, following public health guidance as released by the government. Thank you very much for the opportunity.
Thank you, Dr. Murthy. I had no idea that you were both a survivor and a warrior.
Yes,
well
sir.
done, well done. I recall your mention during your discourse that it gave you no comfort as a doctor to know that you were being treated for a malady that had no existing protocols at that time. But of course, you did mention that now 18 months later, things have improved and the knowledge and the research has strengthened the hands of our warriors, and you are certainly one of them. You did mention a telling statement, and you said that most doctors have seen more deaths in this 1 year than they have seen in their entire lifetime. And you ended by saying that hygiene and vaccination are essential for the general community. Thank you very, very much, Dr. Murthy. Thank you very much for being a part and a great part of our own RAC hospital. Thank you so much. Now, ladies and gentlemen, thank you so much for associating with this webinar. We have received several requests to make available more readily our RAC Hospital Physical Rehab Program, which we started several months ago. Now, we started a physical rehab program several months ago in which we made available our medical professionals, we made available our dietitian, we made available our physiotherapist, we made available our psychologist. And now I would like to emphasize that we are merging the physical with the virtual. And if you check our website, you will be able to see more information about physical rehab. We will be making available this facility to the community in Ras Al Khaimah, to the community in Dubai, and the details of how you can register for this are on the website and on this slide that you are seeing. Before I end, I would like to thank our speakers who survived COVID, who we refer to as our survivors. And I apologize for the emotion that I may have presented during this period. My apologies for that. But nevertheless, the speakers, the survivors presented their situations, and it was touching and a learning experience. I am grateful to our warriors. Dr. Murthy was a survivor and a warrior, and Dr. Humam continues to be a warrior. He spoke about several of his cases, and they were all enlightening. I end, ladies and gentlemen, by drawing your attention to our next webinar, which is on the 23rd of October, and we talk in terms of a very current topic, and that is the role of antibody and booster vaccines. My thanks to the entire team of RAC Hospital, that would be IT, who helps us with the program, Arabian Wellness, Dr. Wilku, Sadeh, Mr. Shrikant, Soloni, and the entire team. Thank you very much for all your support. And with that, have a good day. Thank you.